I want to talk today about the topic that's, on everybody's mind, that's burning through all the news channels. It's Obamacare, the HR 3200 bill, the healthcare bill, or what I like to call socialized medicine. If you think that this is a good idea, guys, what's wrong with you? It's time to take the rose-colored glasses off. It's time to see through the smoke screen and see that this is just another attempt, another private industry. First and foremost, another private industry, the insurance industry, being taken over and controlled by the federal government. There's banking, there's the automotive industry, there's oil, and now there's going to be healthcare. They're controlling every facet of our life, every part of our system with socialized medicine. It's a real bad idea. There's countries in Europe that are trying to eliminate, get rid of their socialized medicine programs. Why? Because they don't work. They've bankrupted the country. The amounts of money it costs to run something like this. The people are fed up with it. The quality of care is hideous. I mean, you can get better care in some of these countries if you're an animal going to the vet than you are a human being going to see a doctor. And I saw an interesting video by Steven Crowder. Very, very funny individual. But he went undercover to Canada, where he's from, to get the real scoop. Not this Michael Moore doctored up documentary BS. Okay, he went in and took hidden cameras into the emergency rooms and the clinics up there to see what it's really like to get government quality health care. Now remember, folks, that the Canadian system of socialized medicine is what they keep saying they're basing our system off of in HR 3200. Now, he went undercover to the emergency room, said that he was injured, a skateboard injury on his wrist, and it took him 2.5 hours to see the nurse, to get evaluated, to see what, where he would be in line to see the doctor. He waited another 2 hours. It was like a 4.5 hour wait, and he decided to get up and leave because he still didn't see a doctor, and there was no light at the end of the tunnel. He actually had to take a ticket, a number that my customers get when at the meat market, when I'm cutting meat, like the deli ticket, get at the grocery store. Had one of those. They're ridiculous. What are we, cattle? Here's a number. Wait in line. When the doctor has time, he'll see you. Oh, sorry, the doctor's gone home for the day. You don't get your health care. It's ridiculous. It's out of control. Okay? And this is the system that they want to implement. One thing that keeps bouncing back and forth in my mind like a hideous nightmare is Obama sitting there saying during his campaign, in my health care program, if you have insurance, you get to keep it. If you need insurance, you can share in the same insurance that Congress has. Remember that, folks? I do. Like I said, it circles over and over in my head like a horrible nightmare, like Groundhog Day or something. I wake up every morning hearing that ringing in my head. Well, I haven't read all 1,000+ pages of HR 3200 yet. I've gotten about a third of the way through, but I've gotten to that point. The whole grandfather clause of the health care bill. That if you have insurance, you're grandfathered in, you get to keep it. But after government health care insurance is put into effect, that's what you get signed up for. Okay? So you keep your insurance, it gets grandfathered in for 5 years. Your insurance has 5 years to integrate itself into the government program. After 5 years, guess what? You don't keep your insurance. You're now blanketed under the government socialized medicine. And they tell you what doctor to go to, when you can go to. Another thing in Canada about a doctor. You don't have a family physician? You want one? Here, you go through the phone book, you call, you see if he's taking new patients. You go in, you register, you fill out your paperwork. Boom. You've got a doctor. In Canada, you go to the clinic, you register for one. The average wait for a family physician in Canada, 3 years, my friends. 3 years. The quality of health care in Canada and in these countries with socialized medicines are so hideous. Why do you think that there's so many individuals from those countries crossing our borders, coming here to our hospitals to get our health care. Why? If it's so horrible and so bad, the system itself is broken. We need health care reform. There are a lot of people that want insurance that don't have it. But guess what? There are so many options you as an American can go through to get health care. There's health care for unwed mothers. There's health care for low income. You know, there's Healthy Start. There's WellCare here in Ohio. Tons and tons of programs. You just have to get off your behind and apply for them. So if you can't afford health care because you don't make enough, your household income isn't enough, 9 times out of 10 you qualify for some form of already pre-existing government health care. And let me tell you something. The health care you can get is a lot better now. The state subsidized, government subsidized health care that you can get now is a lot better than what you're going to get under socialized medicine. It's just another attempt to control the American people. It's just another attempt to violate the United States Constitution, which is the framework for how our government's supposed to work. And bottom line, in a nutshell, it's we the people that control our lives. Our government officials are elected by us, and they work for us. Well, I don't know about you, but what I see on the news and what I see going on day to day at every level, city, county, state, federal, every level, these people are out of control, and they ignore us, and they insult us when we question their actions. It is insane. It is wrong. They are blatantly violating the Constitution, and it needs to stop. They need to rise up. Perfect example. Look at the town hall meetings. There are a lot of peaceful protesters, just a lot of people in general that are going there, and they are questioning. They are questioning their representatives about this bill, what they liked, what they don't like. A lot of them are getting kicked out. They're being locked out. They're being attacked by SEIU union members, which our current administration has told to go and hit back twice as hard. They're being arrested. They're being called angry mobs. I don't know. I don't know what's going on. Don't you guys see what's going on? It's just the country is falling apart, and our government is slowly chipping away at our freedoms, slowly chipping away at our morale, and they're taking control. Now there's an event coming up that's taking place in Washington, D.C. on September 12th. Yes, that's 9/12/2009. A huge rally. It's time to get up, get to Washington on September 12th, and let your voices be heard. There's links on all the sites on the internet. If those of you that follow me on Twitter or on Facebook or here on the video blog, there's links there. Make sure you go check them out. Come down to the rally. I'll be there. You know, thousands upon thousands of patriots will be there. We're all going to stand up to our government because we're not going to take it anymore. We're losing control, and we need to fight back. And we need to arm ourselves. And like I said in my last video blog, we don't arm ourselves with weapons because that's going to get us nowhere. That will prove to the opposition that we are the angry mobs. We need to arm ourselves with the facts, with the truth. We need to learn about our Constitution and know exactly what they can do and what they can't. It's the only solution.